Have you ever received a blood test result that seemed concerning, leaving you wondering about its true meaning? It is completely natural to feel a bit anxious when medical terms pop up, and you are trying to understand what they might mean for your health. The direct answer is no. High muscle enzyme levels do not always indicate muscular dystrophy. While elevated muscle enzymes can be a crucial indicator in the diagnostic process for muscular dystrophy, they can also point to a range of other conditions and circumstances that are not related to this group of genetic disorders. The primary muscle enzyme often looked at is creatine kinase, or CK. This enzyme is normally found inside muscle cells. When muscle cells are damaged, this enzyme leaks out into the bloodstream, causing the levels to rise. This leakage can occur due to various reasons, from intense exercise or muscle injury to certain medications or other health conditions like thyroid disorders or even heart issues. So, while muscular dystrophy involves muscle damage, many other things can cause this enzyme to elevate, making it just one piece of a larger puzzle. If your blood tests show elevated muscle enzyme levels, it is important to remember that this result is usually just the first step in a diagnostic journey. Your healthcare provider will likely recommend further evaluations, which might include repeating the CK test, considering other blood tests, conducting a physical examination, or even referring you to a specialist like a neurologist. These steps help differentiate between the various potential causes for the elevation. Understanding the role of creatine kinase is really quite important because its levels can sometimes be extremely high in conditions like Duchenne muscular dystrophy, sometimes thousands of units per liter. However, temporary or moderately high levels can also be seen in people who have recently completed a strenuous workout, experienced trauma, or are taking specific medications such as statins. A comprehensive diagnostic approach ensures that temporary or minor issues are not confused with more serious, progressive conditions. Ultimately, recognizing that a high muscle enzyme level is a signal, not a definitive diagnosis, empowers you to partner effectively with your medical team. It paves the way for further investigation and helps your doctors build a complete picture of your health, leading to an accurate diagnosis and appropriate management plan.